በዚህ ዓመት ከተለያዩ የከፍተኛ ትምህርት ተቋማት የፕሮፌሰርነት ማዕረግ ያገኙ አባሎቻችንን ሪኮግናይዝ የምናደርግበት ከነሱም የምንሰማበት ጊዜ ነው የሚሆነው።
The first thing to say is nothing is done just by one person. I have a large number of colleagues with me and leaders like Professor Attalay working with me in this regard. So when I talk about this, you have to think about everybody else that was involved. So for me, I have been part of 30 research projects of worth over $50 million. What I need now, $50 million is a little bit embarrassing. What I need, to be honest, is about $1 billion for CDT Africa. But that will take a bit of time to.
My sister got sick, so my mother and me took her to a hospital in Adwa Hospital, and we were waiting until 9 o'clock in the morning when a physician, not a physician, his officer, Dr. Zaru, you know him, came. Everybody was blessing him, and I asked my mother, what is he? Then she told me he is a doctor. So how is it possible to be a doctor was my question, and she told me that if I study more I am able to be a doctor.
Manda Ababa, psychiatry is the most social of the natural sciences and the most natural of the social sciences ነው የሚባለው። ሶ ኢንተርፌስ ላይ ያለ ነው። ሁለቱንም አጣምሮ የያዘ ስለሆነ ነው። በዛም ደስተኛ ነኝ። የሙያ ጉዞዬን እንግዲህ አዘ ጂፒ እስከ 2004 ሰርቻለሁ። ፕሬዚደንሲ እስከ 2008 ከዛ በኋላ ከ2008 ጀምሮ ላለፉት 14 አመታት አዘ ሳይኪያትሪስት እየሰራሁ ነው። አዲክሽን ሳይኪያትሪ 2013 ነው የጨረስኩት። ማዕረጌም እንግዲህ በተቻለ መጠን በጊዜ ፕሮሞትን ለመሆን ጥረት አድርጌያለሁ። አንዳንድ የሪቪው ፕሮሰሶች አዲስ አበባ ዩኒቨርሲቲ ቢሮክራሲ ዲሌይ ካልሆነ በስተቀር የመጀመሪያው ፕሮሞሽን ልክ 4 አመት ሲሞላኝ ሐምሌ 16 ሞልቶኝ ሐምሌ 17 በ4 አመት ነው አፕላይ ያደረኩት። ልክ አሶሺየት ከሆንኩ በኋላ ደግሞ በ5 አመት ለፉል ፕሮፌሰር አፕላይ ያደርጋለሁ ብዬ 4 አመት ከ11 ወር ላይ ነው አፕላይ ያደረኩት።
I'm not yet tired to do research, and I would like to do research, and my vision to my department is to establish Center of Excellence, that is Ophthalmology Institute, and finally I would like to acknowledge my Lord and my parents and my department and the college, School of Medicine, and Addis Ababa University, my colleagues, my mentors, and my friends, and also my family. Thank you very much.
When you have gray hair as I have, you have opportunities to contribute. What you do with that opportunity is a different matter, but I had different opportunities to contribute within Ethiopia as well as outside Ethiopia.
Major areas are solid waste technology, air pollution, waste to energy, and water pollution. National contribution, improvement of solid waste management. These are the technologies I developed. This is the natural system, and the new CPE model I developed. Key message to the youth is you are in a golden age where you can shape your future, think big, be creative, and change the world. From technical assistant to a professor, here I am.
እንደዚህ አይነቶቹን ምርምሮች በተለይ ምርምሩ በሚሰራበት ጊዜ ሄልዝ ሲስተም ባለሙያዎችን አሳትፎ ማበረታታት፣ አዲስ ነገር እንዲቀስሙ፣ በተለይም የተደረጉ ምርምሮች ያሳዩትን ውጤት ዲሲሚኔት ማድረግ እና ኢንፍሉዌንስ ማድረግ በጣም ይጠበቃል ብዙ ጊዜ። የሆነ ሆኖ ግን በአብዛኛው አይ ቲንክ የሚደረጉ ምርምሮች እንደዚህ አይነቱን ፕሮሞሽን ለማግኘት ሆኖ ሲቀር ያሳዝናል። ሲስተሙ ላይ ኢምፓክት ከሌለው ማለት ሄልት ሲስተሙ ላይ በተለይ እንደ ቡታጅራ ያለው ፊልድ ቤዝድ አክቲቪቲስ ያንን አካባቢ ሄልት ሲስተሙ ውስጥ ያሉትን ባለሙያዎችና ሄልት ሰርቪሱን እዛ አካባቢ ያለውን ኢንፍሉዌንስ አድርጎ ሞዴል ሳይት ለህብረተሰቡ ሪሊ ጥሩ አገልግሎት የሚሰጥ ሞዴል ሳይት መፍጠር ይቻላል የሚል እምነት አለኝ እና እንደ ጥያቄ ላንሳና ይሄንን ጊዜ አጋጣሚ ተጠቅሜ
ያ የፕሮፌሽናል ካፓሲቲን ቢልድ ያደርጋልና ስለዚህ እንደዚህ ዝም ብሎ ብድግ አድርጎ መተው ሳይሆን ኮንቲኒዩቲ እና ፕላንድ የሆነ ስትራቴጂክ አካሄድ ተጠቅሞ ያንንም እንደዚህ አይነት ኤክስፒሪየንስ ሼሪንግንም እንትን ኮምባይን አድርጎ ሊቀርብ የሚችልበት መንገድ ቢኖር ይጠቅማል።
ሰዎች ሲሄዱ እና ብዙ አቺቭ ሲያደርጉ ተመልክተናል። እያንዳንዳቸው ከዲስካሬጅ ሊያደርጋቸው የሚገባውን በመነሻቸው ላይ በህይወታቸው መጀመሪያ ላይ ያጋጠማቸውን ዲስካሬጅመንት ወደ ኢንካሬጅመንት ወደ ኦፖርቹኒቲ ቀይረውት ወደ ከፍተኛው ደረጃ ላይ እንደተወረወሩበት ተመልክተናል እና ይሄ ኮሚትመንት እስከ መጨረሻ ድረስ ፖቨርቲ ድህነት የሚባለው ነገር ሊሚቲንግ ፋክተር አለመሆኑን ከሁሉም በላይ አይተናል። ሁሉም በሚባል ደረጃ ወይም አብዛኛው በጣም ከዝቅተኛ የኢኮኖሚ ኑሮ ደረጃ የተነሱ መሆናቸውን ተመልክተናል። ስለዚህ እነዚህ ነገሮች ለወደፊቱ እንደዋስ አንደኛ ሴሌብሬቲንግ አወር አቺቭመንት
so different humanity is designing different designs shells to inflict more, and this challenges us as orthopedic surgeon and the next generation where resources are scarce, where inflation, public unrest is high anticipated ahead. This scares us, and the young generation that's replacing us should be prepared to handle the wounded in a better way, and they have to be ready equipment-wise, psychologically, physically, and mentally to handle more injuries, because we expect with the current trend a lot of injuries. And to treat such a soldier, you really need strong guts. It's dismantled, pieces come, you have to assemble, a lot of transfusion, antibiotics, several debridements, reimplantations. This is tough job. Therefore, my message to the next generation of GPs, young surgeons, orthopedic surgeons, is to be prepared with technology, with skills to handle more injuries expected. And this is my second war. I joined the first Ethiopian war when I was young GP immediately, within few days. And that's where we handled a lot. So we have to be ready like that, to fix the fractures. Last before least, this is also preventable injury from local practitioners like bone setters, so and so. Again, we receive lots of. It's not different from cars or wars or bullets. Again, we see this is preventable again. This is again in our list. These top 5 causes of injury in my country, in our country, are preventable. And my message to public health practitioners and this audience is, let us prevent preventable injuries together.
የኮግኒቲቭ ሲምፕተሞቹ እስካሉ ድረስ የቲቪ ፔሸንትም ቢሆን ሲምፕተሞቹን ካሳየ ለዲፕሬሽን ቢታከም አዋጪ ይሆናል። ስታቲስቲካሊ አናላይዝ ስናደርግ ያገኘነው እሱ ነው። ሌላው ደግሞ ቤዝላይን ላይ ዲፕሬሽን ያለባቸውና የሌለባቸው ስናወዳድር ቤዝላይን ላይ ዲፕሬሽን ያለባቸው ሰዎች በብዛት ይሞታሉ 3 times 3 fold ይሞታሉ። ወደ 7 ፎልድ ዲፎልት ያደርጋሉ። ያ የፈራነው ኮሚኒኬብል ኮንዲሽኑ ወደ ነን ኪውሬብል ኤፒደሚክ ይቀየራል የሚለው ስጋት አለ። ስለዚህ ከሰጠኝ ጊዜ አንፃር በዚህ ማቆም እንፈልጋለሁ። ወደፊት ፊውቸር ኮንሰርን የምላቸው ረዘም ላለ ዓመት እየኖርን ነው። we are living longer ነው። we are living healthier የለም ዳታ we are not living healthier መልታይ ሞርቢዲቲ እየመጣ ነው። ለዚህ ሄልዝ ሲስተማችን አልተዘጋጀም። በዚህ ላይ ጥረት እንዲደረግ ጥረት አድርጋለሁ።
Thank you, our presenters, for being here today.
First stage of labor and its predictors among women who gave birth in public hospitals, Addis Ababa.
An economically empowered woman, I think, would have had less children than, what your model did. So that is what I wanted to ask. It's good that, this task shifting works because particularly ultrasounds and other imaging facilities are usually located in the big urban centers where women could not afford to go to, and the best option is to take the instruments down to where people live. Good. I see you have had a training for midwives who were able to do this ultrasound test.
Trends and determinants of quality of family planning counseling service in Ethiopia. That's the data analysis is done using PMA surveys. So it is just using 7 repeated surveys. So the analysis is just based on 7 round of surveys. So to start with, I'm focusing on quality of family planning counseling because it is important also for to wider the coverage of family planning. So as you know, improving the quality of family planning counseling, it is a key factor to attract new contraceptive users and also to maintain the existing users. So
the level of women empowerment and respect on fertility in Ethiopia was assessed using the DHS data.
Were there, any provider or healthcare system factors that are contributing to this decline of family planning counseling? I think that would be very important for programming purpose. So if there was any data related to that in PMA, I guess this was all from the PMA data, but just curious to know that if there is any.
We are very interested to add some more variables, especially on community level, like that of attitudes and substance use. But due to the missing values of the variable, we miss to incorporate those variables in addition to what we observe more, which is important for our public health intervention. Sure, it is very important. Important one is community level one.
have you tried to look into for the practical or application of your result into real life situation? Did you try to at least wait about those factors? Do they act in combination, or one of the determinants or predictors may have compared to the other weighted effect, the weighted effect of individual factors, so that we can we may not get them in combination, maybe for all in one of the case, that case which one should be given priority. So that would have been better than the combined effect alone.
What is your base to forward or reach at this conclusion?
We have to find out or coin words that can really tell us, define what conflict in this situation.
The public institution should be not targeted like Ethiopia, and also be bilaterally attacked in the other world. The second point is, I would like to appreciate all the Ministry of Health and other organizations taking the initiative during the post-conflict. But what is the role of the health professionals?
በየትኛውም የጦርነት አውድማ ውስጥ የማህበራዊ ተቋማት የእምነት ተቋማት አልወደሙም። የመጀመሪያው ታርጌት ግን ቬሪ አንፎርቹኔትሊ እኔ በአካልም ሄጄ ስላየኋቸው ትምህርት ቤትና ጤና ተቋም that the saddest part of it እና በየትኛውም ካልኩሌሽን እና በየትኛውም ህግ ብንመጣ በየትኛውም የሞራል እሳቤ ተቀባይነት የለውም። መጀመሪያም እንደጠቀስኩት የሂውማን ካፒታል ኢንዴክሱን ለማውደም የተነሳ አካሄድ ስለነበረ ነው። ምክንያቱም የሀገራችን የሂውማን ካፒታል ኢንዴክስ እንደምታውቁት ሎው ነው። ምክንያቱም ገና ትምህርትና ጤና ላይ መስራት አለብን። አንፎርቹኔትሊ ይሄን ለማውደም የተጀመረ ጦርነት ነው። ለዚህ ደግሞ ይሄ ግልጽ ነው። የእምነት ተቋማት ወድመዋል፣ ትምህርት ቤቶች፣ ጤና ተቋማት በይበልጥ ዳሜጅ ተደርገዋል። ለዚህ ደግሞ አሶሲዬሽኑ የሚገባውን ኮንትሪቢዩት ማድረግ አለበት። እያረገም ነው ብዬ አስባለሁ። መንግስትን መደገፍ ነው በየደረጃው።
ብዙ ነገር አሁን ጀንደር ቤዝድ ቫዮለንስ የጀንደር ጉዳይ ብዬ እኔ አልወስደውም። የጀንደር የጀስቲስ ጥያቄ ነው። ሚኒስትሪ ኦፍ ጀስቲስ ነው ሊድ ማድረግ ያለበት ብለን ነው እኛ የምናስበው። ያም ሆነ ይሄ ጀንደር ቤዝድ ቫዮለንስ እንደ ክራይሲስ መታየት አለብን ስንል አሁን at this time መንግስት እያየ ነው ብዬ አላምንም። ግን እንደ EPHA definitely something you can advocate for ብዬ አምናለሁ። ሞር እንደዛ ቢደረግም ጥሩ ይሆናል ብዬ አስባለሁ። አሁን ይሄን አመት በዚሁ ቶፒክ እንዳወራ ነው ጋበዛችሁኝ። ባለፈው አመትም በተመሳሳይ ቶፒክ ነው የተናገርኩትና ሆፕፉሊ እንደ ፕራዮሪቲ አይታችሁት አድቮኬት የምታደርጉበት ነገር ነው።
በዲፍረንት ሲቹዌሽን በኮንፍሊክቱ የተጎዱ ሰዎችን ህመም ያለባቸውን ሰዎች ሰርቭ ሲያደርጉ የነበሩ ባለሙያዎች አሉ። ዲስፓይት ዘ ሲቹዌሽን አላው የሚያደርግ ነገር በሌለበት ሁኔታ ላይ ፕሮባብሊ ለኢፒኤችኤ ፕሊ ማድረገው እንዲህ ያሉ ሰዎችን አስ ፓርት ኦፍ አወር አኑዋል ኮንፈረንስ ሪኮግናይዝ የምናደርግበትን ኤግዛምፕልስ ናቸው። ዲስ ኢዝ ፕራይመሪሊ a courage.
As Ethiopian Public Health Association ደግሞ as an organized professional group የምንሰራው ነገር አለ። ያንን በኃላፊነታችን የምንሰራውን ይበልጥ አሳልጠን በተቻለ ፍጥነት ሪስፖንሲቭ በሆነ መልክ መስራት ግዴታችንና ኃላፊነታችን ነው የምንሰራበት መስክ ስለሆነ ይሄኛው ግን የኢትዮጵያ ፐብሊክ ሄልዝ አሶሲዬሽን ኢትስ a voluntary association የህዝቡን ጤና ለህዝቡ ጤና ለመቆም የተደራጀ ማህበር ነው። ስለዚህ በዛ ረገድ ማህበራችን ምን ሊያረግ ይገባዋል፣ ምን ማድረግ አለበት፣ ምን ቀርቶታል፣ ከማጋራ ቢሰለፍ የተሻለ እንትን ማድረግ እንችላለን፣ ቻፕተሮቻችን ምን አድርገን ብናጠናክር ለዚህ ላለው አስቸኳይ ህዝባዊ እርዳታ ልንደርስ እንችላለን የሚለውን ራሳችንን መርምረን አሁን ይሄንን ካላረግን we have failed ብያምናለሁ በዚህ ረገድ።
Civil society organization EPHA has shifted from the general accounting principles GAP to a newer system called International Public Sector Accounting Standards. Therefore, the budget for 2021 physically is audited based on IPSAS standards. ይሄ አዲሱና በጣም አስቸጋሪ የነበረ ነው። ሰዎች ማሰልጠን ነበረበት። EPHA አዲስ ሲስተም ነውና በዚህም የተነሳ ኦዲት ሪፖርቱን ትንሽ ዲሌ ሆኖ ነው ለኛም የደረሰን።
ፕሮግራም ወጪውና ያስተዳደሩ ወጪው በፐርሰንቴጅ መታየት ስላለበት የፕሮግራም ወጪው አጠቃላይ በአመቱ 61 ሚሊዮን 172992 ነው። ለአስተዳደር የወጣው ወጪ 14 ሚሊዮን 929775 ነው። ጠቅላላ ወጪው 76 ሚሊዮን 102767 ነው።
Welcome to the last day of EPHA conference.
Right after the occurrence of this conflict, the Ministry of Health has tried to promptly respond by establishing an incident management system, that is the incident manager being Her Excellency Dr. Addis.
The Ministry of Health face-based approach treat ለማድረግ ነው እየሰራ ያለው። በጣም highly organized, በጣም effective የሆነ intervention ነው የተደረገው።
When I go to the impact of the conflict for each region, for Amara region, at least 14 hospitals, 453 health centers, 1,850 health posts have been damaged as well as looted.
My presentation topic is the impact of traffic restrictions on particulate matter pollution in the case of Addis Ababa.
There are some markers that you can take from the particulate matter pollution content rather, and just do it very advanced lab in the US, and they found about 28% exactly comes from vehicles. That's very important. So this is what really we can assume. But otherwise, it would have been much better to compare, like for example, the lockdown took about 60 days, March to May, something, 60 days. The 60 days particulate matter concentration with 60 days of previous years.
The question is, where should we start, or how can we really build back better? It cannot be done overnight. It cannot be done in such a short period of time, but we have 3 phases at least: the short term, the immediate one, and then the medium term, and then the long term recovery.
Community-based nutrition education, group education was.
Tools were adopted from WHO, Iodine Global Network, from our census data and so on, from validated source.
And to see some of the factors we have identified as a risk factor for days during hospital admission, the HIV status of the children at admission, the antibiotic, whether they take antibiotic or not.
How do people know that they are feeding on iodized salt or any other?
And also I couldn't find the
portion which states about iodine deficiency disorder.
Unless and otherwise there would be a high prevalence of goiter studied and proved by the researcher, iodized salt to distribute in any part of the province.
There are salts that leak, non-iodized salts that leak and sold in the market.
It's not only the Women Development Army which are not active. I mean, the whole system, including health extension worker, PHC workers are not active.
ትንሽ ያለምረ ፔሲሚስቲክ የሆነ ቪው ነበረኝ በጤና ጥበቃ ሚኒስቴር ላይ። በአሁኑ ኦፕቲሚስቲክ የሆነ ቪው ነው ያለኝ እና የፕላኒንግ ፕሮሰሱ ሁሉ እኔ ኢምፕሬስ አድርጎኛል።
We are all aware that since 2017, there's been this WAREDA-based health sector planning process that has been in place.
Where there is a top-down and a bottom-up approach.
In order not to have a repetition of the same issues, we have to establish identification of resources.
Grassroots level community mobilization and working with the community is very key.
ጥሩ የገጽታ መገንቢያም ሆነ የፓን አፍሪካኒዝም ማራመጃ የታሪካዊት አገር ቦታ ስለሆነ ይሄንን ሴክሬታሪያትና አሶሲዬሽን በተቻለ መጠን ለመርዳት እንጣር።
Research should be bound with 4 principles. The first principle is empiricism. Every thing should be based on the data, the evidence, the empirical evidence, not the pretending. I think Freo is pretending COVID may exacerbate the vaccination inequalities. So this may violate the empiricism. And the research should be objective, rigorous, and research should be based on theory. Research should be ethical standard.
Equitable access to vaccination services for all children is a critical target for sustainable development goals. So with this agenda, we aim to examine inequalities in child vaccination coverage within and between 25 sub-Saharan African countries. In addition, we looked at factors that predict inequality in child vaccination coverage in sub-Saharan Africa.
Improved collaboration between public health experts and political scientists in predicting, preventing, and measuring conflict-related diseases and disabilities. Finally, EPHA, together with other professional associations, should advocate for protection of health facilities and health workers during armed conflict. EPHA, together with other professional associations, should mobilize their membership to provide mental health and psychosocial support to health workers and communities affected by the conflict. EPHA, together with other professional associations, should ensure recovery efforts are guided by evidence. So ይሄን ነው ያዘጋጀነው።
መጨረሻው ላይ ግን ወደ ሶሉሽኑ መሄድ አለብን። ፋርዘርም ችግሮች እንዳይመጡ ፋርዘር ችግር ቢመጣም እንዴት ነው ሪዚሊየንት ሆነን የምንቀጥለው ምን ላይ ነው ማተኮር ያለብን የሚለው ላይ ደርሰናልና በተለይም ሲስተም ላይ ሴቭ ልናረጋቸው የምንችለውና ያጣናቸውን ሲስተሞች አሁንም መልሰን መጠንቀቅ እንዳለብን የተረዳንበት ነው እና እኔ በጣም እጅግ በጣም አቴንቲቭ ሆነን ያዳመጥንበት ነው። አይ ቲንክ ኦንላይን የሚያዳመጡ ሰዎች እንደዛ ይመስለኛል። በጋራ ተገናኝተን ለጤና ሚኒስትርም የጠቀመው ይመስለኛል ሁላችንምና ችግራችንን ያየንበት እንዴት እንደምንሄድ ጋይድ አድርጎናልና this was a successful gathering.